Hello, I'm Dr. Shaadi Khademi, and I'm an occupational medicine physician. I'm Medical Director of the Occupational Health Clinic, Director of Employee Health, and Assistant Professor of Occupational and Environmental Medicine here at the UT Health Science Center. Today I will be discussing how to prepare for the flu season. As we gear up for flu season this year, questions may arise about how to prepare during an ongoing pandemic. Today we will talk about important considerations this flu season. In the United States, the flu season occurs in the fall and winter, and flu activity peaks between the months of December and February, but activity can last as late as May. Every flu season is different, and it can affect people differently. An annual seasonal flu vaccine is the best way to help protect against flu. Vaccination has been shown to have many benefits, including reducing the risk or severity of flu illnesses, hospitalizations, and even the risk of flu-related death. Annual flu vaccination is for everyone aged 6 months and older. It takes about 2 weeks after vaccination for antibodies to develop in the body and provide protection against the flu. Getting vaccinated early in the fall is recommended before the flu season begins. The CDC recommends that people get a flu vaccine by the end of October if possible. However, vaccination should still continue throughout the flu season, even into January or later. If you get sick with flu symptoms, you should stay home and avoid contact with other people except to get medical care. If you have symptoms of flu and are in a high-risk group, are very sick or worried about your illness, please contact your healthcare provider. Stay away from others as much as possible to keep from infecting them. If you must leave home, for example, to get medical care, wear a face mask and cover coughs and sneezes with a tissue. Wash your hands often to keep from spreading flu to others. Measures such as masking and social distancing that are recommended to prevent the spread of COVID-19 also prevent the spread of all respiratory illnesses, including the flu. You may wonder how to tell the difference between the flu and COVID-19. The flu and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. Because some of the symptoms of flu and COVID-19 are similar, it may be hard to tell the difference between them based on symptoms alone, and testing may be needed to help confirm a diagnosis. These two viruses share many characteristics, but there are some key differences between them. Both COVID-19 and the flu can have varying degrees of signs and symptoms, ranging from no symptoms to severe symptoms. Common symptoms that COVID-19 and the flu share include fever or chills, cough, shortness of breath, fatigue or tiredness, sore throat, runny or stuffy nose, muscle pain or body aches, headache, nausea, vomiting, and diarrhea. Other signs and symptoms of COVID-19 different from the flu may include change in or loss of taste or smell. Both COVID-19 and the flu can spread from person to person, between people who are in close contact with one another, within about 6 feet. Both are spread mainly by droplets made when people with the illness cough, sneeze, or talk. It may be possible that a person can get infected by physical human contact, such as shaking hands. Both flu virus and the virus that causes COVID-19 may be spread to others by people before they begin showing symptoms, with very mild symptoms or who never develop symptoms. You may wonder if you can have the flu and COVID-19 at the same time. It is possible to have the flu as well as other respiratory illnesses like COVID-19 at the same time. Health experts are still studying how common this can be. The single best way to prevent seasonal flu is to get vaccinated each year. However, remember that taking the following steps can protect yourself and others from the flu and help stop the spread of germs. Number 1, avoid close contact. Avoid close contact with people who are sick. When you are sick, keep your distance from others to protect them from getting sick too. Stay home when you are sick. Stay home from work, school, and errands if possible when you are sick. This will help prevent spreading your illness to others. Number 3, cover your mouth and nose. Cover your mouth and nose with a tissue when coughing or sneezing. It may prevent those around you from getting sick. Number 4, clean your hands. Washing your hands often will help protect you from germs. If soap and water are not available, use an alcohol-based hand rub. Number 5, avoid touching your eyes, nose, or mouth. Germs are often spread when a person touches something that is contaminated with germs and then touches his or her eyes, nose, or mouth. Number 6, practice other good health habits. Clean and disinfect frequently touched surfaces at home, work, or school, especially when someone is ill. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, and eat nutritious food. Please do your best to practice these measures to protect yourself and others this flu season. Thank you.